Welcome to the Optimum Academy. This is the Heart series, and this is Heart 101, video number 2 on coronary artery disease. I'm Minnis Joannides, the Chief Medical Director at Optimum Life Reinsurance. So let's get started. As you can see from the 10 leading causes of death by age group in the United States, this is from 2018, but the numbers are still valid for what we can use today. You will notice that at ages 65 and older, heart disease is by far the largest cause of death in the United States. So it's a very important disease that we need to appreciate, especially when we're underwriting life insurance cases. You can see what the other main causes of death are. Heart disease is followed by malignant neoplasm, which we also want to screen our applicants for as well. So the coronary arteries, which we'll talk about in this video, are on the outside of the heart, and they arise from the aorta. So blood is provided through the right coronary and the left coronary artery system to provide oxygen and nutrients to the heart muscle. So obviously they are very important. If for some reason they become clogged or stenosed, then there can be a problem with the pump function of the heart in that particular zone. And that's what we try to find out about with EKGs, stress tests, perfusion tests, and other things of that nature to try to assess where there might be risk due to coronary artery problems. So narrowing of one of the coronary arteries can be a problem. So what are the methods we use to try to establish if the coronaries are clear or if there is stenosis? Coronary catheterization is the gold standard. Other tests are used, including coronary CT or MRI angiogram. We use coronary calcium scores to try to assess how much calcium is in the coronary arteries, which is a proxy for stenosis in those arteries. And then perfusion or SPECT tests to try to elucidate if there's any stenosis or poor function in a particular part of the heart that suggests ischemia. There's the stress echocardiogram, where an echocardiogram is performed while the person is undergoing a stress test, and then the treadmill stress test itself. If there are stenoses in one or more coronary arteries, the applicant may have angina, which is chest pain that occurs during exercise and is relieved by rest, or they might just demonstrate ischemic changes on any one of the tests noted above. What's the treatment for coronary artery disease? One of the treatments is angioplasty, where a tube is put into the coronary artery to hopefully blow up the inside diameter of the artery and allow blood to flow more freely through the coronary artery. Sometimes a stent is put in to maintain that open area of the stenosis that was previously present. So you may often see angioplasty with a stent placement for people who have coronary artery disease and apply for life insurance. Sometimes major surgery is required, where the person has open chest surgery and has a bypass of one or more of the coronary arteries in the function of the heart. A heart attack is also called a myocardial infarction, or MI, and that leads to dead heart muscle, which obviously is a major mortality risk when we're underwriting life insurance. So a coronary angioplasty is demonstrated here, where a stent is delivered inside the coronary artery. It's expanded as the balloon inflates, the catheter is removed, and the stent remains to keep the stenotic area open. A myocardial infarction is when the blockage of blood flow to a portion of the heart muscle occurs, and there's actually death to that heart muscle, and it has a particular signature on the EKG if that is done in a time period related to when the MI is occurring. And you can see I've demonstrated with a red arrow that the ST changes are elevated in certain leads, and that's what we call an ST elevation myocardial infarction, or a STEMI, the ST. Sometimes there's no particular change on the electrocardiogram, although the person did demonstrate that they had a heart attack, so we would call that a non-ST elevation myocardial infarction, or a non-STEMI. So that completes our second video on the heart. Please join us for video number 3 on the heart to continue the series of Heart 101.